of you. I'd like to welcome all of you to our June 2021 meeting. And if our board is able, our clerk of the board is able, will you please do a roll call vote, a roll call?
Sure, give me just a second. I'm letting Dale in. Director McGarry.
Good.
Director Shamblin. Oh, he's still connecting to audio. Director King.
Here.
Director Brown.
Here
Director Wong.
and here.
Director Chamberlain here too.
Thank you. And will General Counsel report on the actions taken in closed session?
Yes, the board considered 6 items in closed session. The first was a hearing under Health and Safety Code 32155 regarding the 2021 score survey. There was no reportable action. Number 2, conference with legal counsel regarding initiation of litigation. The board approved initiation of litigation on a 4-to-1 vote, with Director McGarry voting no and all other directors voting yes. The action, the defendants, and the other particulars shall, once formally commenced, be disclosed to any person upon inquiry, unless to do so would jeopardize the district's ability to effectuate service of process on one or more unserved parties. For item 3, there was no reportable action. That was a liability claim. Item 4, conference with legal counsel regarding existing litigation, the Tahoe Forest versus Anthem case. There was no reportable action. The approval of the closed session minutes for May 27 was approved unanimously. And the medical staff credentialing recommendations under Health and Safety Code 32155 was also approved unanimously. And that ends my report.
Thank you. Are there any deletions, corrections, or any other adjustments to the agenda? Okay. Hearing and seeing none, I'm going to open up for audience input. And Martina, have we got anybody who's written or called in with any issues?
I have not received any public comment written.
And do we have anybody in the audience? Martina, can you tell them if they're in the audience what they should do in order to speak?
Sure, if you'd like to provide public comment, you may either unmute yourself or feel free to raise your hand via the reactions button in your toolbar.
Okay, I don't see any hands waving. And then we'll move on to input from the Employees Association. Have you received any written or texting from the Employees Association of any issues?
We have not.
Okay. Then we'll go ahead and move on to item 12, the June 2021 Employee of the Month. And I think we have our Chief Human Resource Officer available to talk to us.
Hi, yes, can you hear me okay?
Yes.
Okay, I was having computer issues, so I apologize. Well, I've got the privilege and honor tonight to recognize Cassie Keene as our Employee of the Month for June. Cassie is a physician informatics coordinator in IT, and here's a few things that Cassie has to, or some people have said about Cassie, excuse me. Cassie is honestly one of the hardest working employees at Tahoe Forest. She is accountable, responsible, and sees countless projects all the way through. She is a go-to for providers and staff and is willing to jump in and try to help solve a problem even when it's not her job or area. She takes on anything, she takes on anything that comes her way, gives it her all, and works hard to be a team player and does quality work all the time. She displays the system values of quality in so many ways. Cassie gives herself completely to the work and cares deeply about her job and her colleagues. If anyone deserves recognition and this award, it's her. So give it up for Cassie. Thank you.
Good job, Cassie.
Congratulations, Cassie, and all of the nominations for Employee of the Month. Item 13, the Medical Staff Executive Committee's meeting consent agenda, and we have Dr. Lane to present those.
Okay. Dorothy, do you want to put up your screen, please?
Sure.
So let's see, for our consent agenda, MEC accepted the policies for the neonate annual policy approval. We made no changes there. And the critical access hospital services by agreement, we also made no changes there. And on the next one, rules and regulations, IDPC, which is Interdisciplinary Practice Committee. This is the committee that includes nurse practitioners, PAs, audiologists, everyone else other than physicians. And the only changes we made were to be in compliance with a Title 22 that required a makeup of the committee to include the same number of nurses as physicians. And so we've updated our committee, and it was a relatively small change, but now we're in compliance.
Okay.
If there's no other questions, I have one other thing I want to discuss briefly. Dorothy, do you have more up there?
No, those were the 3 items for approval.
And then I have a question for the board. Well, not as much of a question, but more, are you aware of the work that our Joy in Medicine Wellbeing Committee has been doing on physician burnout? And if you're not, I'll give you a 60-second brief update. It may be worthwhile at some point getting an actual update from the committee, but so physician burnout is a very hot topic across the country and at Tahoe Forest, and they're putting a lot of effort into addressing it and trying to fix it. It's essentially emotional exhaustion or cynicism and lack of joy in people's work. So why is this important? Across America, across the United States, 50% of physicians meet criteria for burnout. And the problem is those physicians who actually meet criteria, they're twice as likely to switch jobs, more likely to cut their hours, more likely to decrease the number of patients. And it's the highest rate of fatigue is seen in early career physicians. And then also an important part for the district to be aware of is physicians who score higher on the burnout scale have fatigue, and that is correlated with more medical errors. And so I would applaud the Joy in Medicine Committee that has been chaired for quite some time by Sam Smith, one of the PAs, and now Portia Adams is doing it. But they're doing a lot of work. They're trying to keep people engaged and minimize this. And if you ever want more on it, we have, maybe we can talk to Alice, but there's a whole presentation that these folks can give you. And I'm just giving you a brief background on why this really is important. We want to, as you probably know, we spend a lot of money on recruitment. The last thing we want to do is spend money on recruitment and lose good people because they're burned out if we can address it and care for it.
Thank you for bringing that up, Dr. Lane. And I think we do have a educational session that's going to come up this summer on Joy of Medicine. And so we look forward to hearing about that. I don't know who will be presenting it, whether Dr. Cole will have a panel or how it will be done, but it is on our calendar.
Excellent. Well, I think hearing, at least I'm giving you superficial highlights, but it's not just, I mean, clearly we'd like to have our medical staff happy, but there's really a cost to the system if we are not achieving adequate or we're not addressing it and removing those factors that are really difficult. And tying this into Cassie winning Employee of the Month, she's been instrumental in taking away of many of our frustrations and things that are not working. And I know she helped me out when if things were not working and I couldn't prescribe any narcotics. And finally I was saying, Cassie, you're going to have to let Jake know we're going to have to switch from Epic and go to something else. I'm sorry, he spent $40 million on it. And she was able to fix the problem.
No, we didn't.
Whatever you spent on it.
Let's not get
Again-
that rumor out there.
We will be hearing more this
Okay.
summer about it, and you know, something that could be applicable to a lot of our employees in terms of burnout, especially after such a challenging year that they've been through. And I think it's almost widespread that right now people are very distressed and maybe negative in so many ways. So I know the physicians are one group, and there are some things that can be done about that. But let's get back to your,
Well,
I
First
don't
of all,
have
thanks,
any-
thanks for bringing that up.
So I don't have any other topics unless people have some comments for me that I can address.
okay, so we do have his, the medical staff consent calendar. Are there any comments on that? It's a consent agenda, I'm sorry.
I would move approval of the consent agenda.
I'll second that.
Okay, it's been moved and seconded. Before we move to a vote, can I ask, is there any question from the audience or any comments from the audience about the consent agenda? Okay, hearing none, we have a motion on the floor now to approve the consent agenda of the Medical Executive Committee. Director King made the motion and Director Brown seconded it.
I think it was the other way around, but
Oh, I'm sorry, Director
That's okay.
Brown. Let's make it clear. Director Brown made the motion and Director King seconded.
It's very important to me.
Well, it's going to be, it's
It is.
going down to posterity in the minutes. So Martina, will you do a roll
It
call
is to
vote?
me. Director McGeary. Director Shamblin.
Aye.
Director King.
Aye.
Director Brown. Director Wong.
Aye. So that, whoops, there goes the power at my house. The consent agenda of the Medical Executive Committee has been approved. So thank you again, Dr. Lane, and thank you for bringing up that important topic on joy of medicine.
All right, I'm going to sign off unless there's anything else for me. All right, thank you.
Good evening.
Take care.
All right.
Item 14, the consent calendar. And these are items that are usually reports and non-controversial. So is there any issue that someone would like to pull from the calendar? Anybody from our audience that want to pull anything out of the consent calendar? All right, then can I have a motion to approve the consent calendar as presented?
This is Art. I'll make that motion.
I'll second, Dale.
Okay, so it's been moved by Director King, second by Director Shamblin to approve the consent calendar as presented.
Director McGeary.
Aye.
Director Shamblin.
Aye.
Director King.
Aye.
Director Brown.
Aye.
Director Wong.
Aye. So the calendar has been approved as presented. Moving on to item 15, board discussion. We're very fortunate to have the Association of California Healthcare District Certification Healthcare District Program. And we have two members, I think, from the association, Marina Cervantes and also Amber. Are you there also? Amber King?
Yes, she's here too. We're here
Well, welcome.
for having us.
So
Yeah,
who's going to start?
I'll go ahead and start. Thank you so much. Thank you. And thank you too to the full board for having us here to present on the Certified District Program. Hopefully you all can see my slides. I'm joined today by Amber King, our Vice President of Advocacy and Membership. And my name is Marina Cervantes. I'm the Member Services and Education Manager. And today we just wanted to go over our certification program and then also answer any questions that the board might have about the program as well. So the ACHD Certified Healthcare District Program was created for districts to demonstrate their compliance in a few key areas. This program was actually originally created in response to legislation in California that was threatening the credibility and autonomy of healthcare districts. So in addition to some of those legal requirements, the program also includes some best practices in governance and transparency. So any district that meets these vigorous requirements and submits an application is designated by ACHD as a certified healthcare district, and that status is valid for 3 years. So Tahoe Forest became originally certified in 2016, and you all successfully completed your renewal application in 2019. So the next time that you will be up for renewal of your certified healthcare district status will be in late 2022. While the ACHD certification program doesn't ensure compliance with all state and federal laws, ACHD staff is sure to evaluate all of our requirements annually to determine if there are any new legal requirements to be added to the program or any additional best practices that we would like to add as well. So there are numerous benefits to being an ACHD certified district. One of the first benefits is that our certified districts are a really great resource for us when we are advocating on all of your behalf in front of the legislature. Our certified districts definitely bring credibility to healthcare districts as a whole, and you all are shown as leaders in compliance and accountability as local government entities. So you are great districts to bring up to whenever we are speaking directly with members of the legislature. Also, for your communities, it does demonstrate some exemplary compliance and good governance. It's a really great resource to point to your community. Also, our certified healthcare districts do all receive a significant discount on any ACHD educational event that does require a registration fee. So that is a great benefit to have as well. The certification status itself is a member benefit, so there is no cost to apply for that status. Also, our eligibility for a few different things require a certification status. So in order to serve as a member on our ACHD Board of Directors, that does require a certified status, as well as in order to be nominated for our District of the Year award, that also requires that status. So Tahoe Forest is one of 17 healthcare districts throughout the state. As you can see by some of these other districts up here, they represent various areas throughout California and provide a variety of services to their communities. All of our certified healthcare districts up here are recognized both verbally at our ACHD annual meeting, as well as with a ribbon on your attendee badge noting your district certification status. So it's a great way to network with other certified districts that you might see up on the screen when you see them around at the conference as well. So we do have a number of certification requirements that go into that application, and we have them broken up into 6 different sections. Each of these have numerous requirements within them, but I'll just go over generally what each of the sections entails. And then if anybody has questions specifically, we would be happy to answer those. The first section that we have is on transparency. This includes some of your required training, such as your ethics trainings, your harassment prevention trainings, as well as some of those policies that show that you conduct public business in accordance with the Brown Act, that you're responsible stewards of public funds. Basically, all of those policies live within that transparency section. The next section we have is definitely the longest in our certification program. That's the website requirements. It covers a number of different website requirements that should be on all healthcare district websites, as well as some best practices as well. So there was legislation that was passed in 2017 and 2019. These both required that all healthcare districts have a website, as well as provided some additional specifics on what type of information does have to be available on your website in order to promote transparency, as well as accessibility to the public. So we have all of those requirements within that section. Then our next section is on executive compensation. This includes your policies on compensation, transparency, the standards that you use to evaluate compensation for executives. Then our next section is on state and local agency reporting. This includes some of that compliance that you have with your local LAFCO. So it includes having a copy of a municipal service review if you've been subject to one from your LAFCO, as well as what the district response was to that MSR. Then we have our financial reporting section. This just includes a lot of the public financial reporting that you have to do, such as financial audits, public compensation information, your annual budgets. A lot of your annual financial information is pretty much held in this section. And then that very last section that we have is best practices. So this is a set of practices that ACHD has determined to be best practices of local governments. So a lot of these requirements that you'll see here are beneficial in helping districts to establish and maintain strategic objectives or goals, or also it could be to help engage the community in some of the district work. So some of the items that you'll see in this section are board self-evaluations, community engagement or messaging, board continuing in education, basically just a lot of those things that help keep the district really active with the public and as a board. So ACHD does maintain a certification portal on our website, achd.org. This contains all this detailed information on our program, as well as some other helpful resources, such as an in-depth guide, as well as a checklist of what all those requirements are. And then we also have a sample library on there that has some exemplary examples for each of the requirements within certification that anyone who's interested in becoming a certified district can use to help them refresh any policies or figure out what other districts are doing on things such as community engagement or something like that. But that is basically what our certification program is. And I just wanted to be sure to congratulate you all on your status as a ACHD certified healthcare district, and thank Martina and Ted. I know especially you put a lot of work into getting that renewal application done in 2019. So thank you so much for that. But Amber and I are also available for any questions you might have, or both of our contact information is available here as well if you have any questions after the fact.
Thanks, Marina, for bringing that up. I know that it's something that we're very proud of, to have that certification, and also what it means to our community as we go out and speak, to know that we do follow the best practices. I'm not sure that they really know that, but you can always pull that out as your ace in the hole if you want to prove something. So thank you again for your presentation. Are there any comments or questions the board might have on any of the requirements for certification? Dale?
I'm just curious to know how many healthcare districts there are in California.
Yeah, of course. So we have 77 total healthcare districts in the state.
So few that are members, I'm curious to know.
So the 17 districts that are certified, that is just a portion of our membership. Not all of our ACHD members are certified, just since it is such a rigorous application process. So it's a little less than half, I would say.
Okay.
Definitely less than half of our members, yeah.
Gotcha. Okay.
And Ted and Martina might attest to the rigorous application that has to be sent them.
Piece of cake. I think we had it done in a half an hour.
Yeah.
No, it's a lengthy and thorough process.
And it's more than just saying, yes, we have it, but the data to validate that indeed we do.
We produce it, Martina produces it, and it's reviewed by ACHD. Everything that is required. So there's a lot of oversight on it.
I have a question, Alice.
All right, Mary, go ahead.
Yeah, thank you very much for the presentation. It was interesting. I'm curious as to how the ACHD interfaces with the California Hospital Association, especially around advocacy and those kinds of issues. Could you speak a little bit about that?
Yeah, of course. Amber King with the Association of California Healthcare Districts. Thank you for the question. We work with the California Hospital Association on every piece of legislation that touches hospitals, in particular, some of the larger issues, Office of Affordability, seismic. Of course, this year we worked in partnership with them on AB 650, which was the hazard pay legislation. And so we're in regular contact with them. I sit on at least 2 calls with them a week, and we bring the district hospital perspective and they bring the larger hospital perspective, and it's often a good balance, especially depending on the issue.
Great, thank you.
I have Quick question, are there hospital districts in every state? And if so, is there a national association?
There's not a national association. It's really dependent on the state. There are a few states that I'm aware of that have district hospitals and districts generally. Some also don't have hospitals. I know Florida and Oregon do, and we have not had a lot of contact with them, at least as long as I've been at ACHD. And there's not a national association because they're not widespread. And a lot of times they can be set up slightly different per state, depending on how local government entities work within each state.
Okay, thank you.
Does our audience have any comments or questions about our certification or ACHD in general? I don't know if you ladies would like to do a promo on the conference that's coming up in our area.
We would love to. We're going to be right there. So I'll let Marina talk on that, but we would love to see you all there, and you would get your certified healthcare district ribbon.
Absolutely. September 22nd through 24th, we'll be there at the resort at Squaw Creek, just right close to you all. So I hope that you all can make it. We do have some different registration options as well. If you are only able to attend for a day, you can attend our governance day or also our general annual meeting on Thursday and Friday. So we definitely hope to see you all there. And we're so excited to come up to your beautiful area.
If you haven't checked out our website yet, it is up. Registration is up and running, and we have a very fantastic schedule this year. Our theme is recover,
refocus, and adapt.
But we do have some really fantastic speakers and some pretty big sponsored speakers by some of our corporate sponsors that we have not had an opportunity to have in years past. So we're really looking forward to seeing everyone in person. So we hope to see you there.
I have been on the Tahoe Forest Board for 8 years and attended several of your meetings. I think they're extremely well organized, well run. And I really appreciate the opportunity of sitting with other hospital board members and in the off hours and having a discussion about relative issues.
Definitely. And this will be our first year that we'll have a trustee roundtable as well during our governance day on that Wednesday, September 22nd. So it's our first time bringing all of the trustees together in person. We did do it virtually last year, but that'll be a great networking opportunity as well to get some of that networking done with other directors of district boards.
Great.
If there's no further questions, I want to thank you, Marina and Amber, for attending our meeting, and hopefully we'll see both of you this fall.
Yes, hoping for it. Thank you so much for having us.
Bye-bye. Our next board discussion is 15.2, Truckee Tahoe Workforce Housing Agency update, and we have Emily Vitus from the JPA here. Good evening, Emily.
Good evening, Chair Wong and directors of the board. Thank you very much for having me this evening. Are you okay with me sharing my screen and getting a presentation started?
Okay, Martina.
Let's see here. Okay, can you see my screen here?
Now, Martina, can you help her share?
She's all set.
Can you see it? Great, wonderful, thank you. Again, good evening, Chair Wong, directors of the board. Thank you for having me this evening, and thank you for your participation in the agency, your willingness to approach our housing solution in an innovative way, our housing situation in an innovative way. Before we get started, I do want to take a moment to recognize Harry and Ted for their support and commitment to this agency and this work. We're also very fortunate to have Judy Newland as our secondary representative for the agency. You know, as the only staff member of the Workforce Housing Agency, it's very nice to know that I have thought partners and advisors are available to me at all times. So thank you very much to all of you for your support and commitment.
Emily, your screen is not up.
It's not?
Your slide presentation.
Huh. It's showing here. Martina, can you see it?
No, we don't see anything projected.
Okay, let me close out really quick and try it over again. Okay. I'm going to share screen.
There you go.
There
Got
you
it?
got it now.
Win. All right. Let me just share my main screen here. Okay, can you see the full screen now?
Yes.
Awesome. Okay, great. Okay, so I'll keep going. So it has been 7 months since we last met, since I last presented to the board. And in that time, we've seen some pretty major shifts in housing accessibility and affordability. Unfortunately, the hospital and our other 3 founding member agencies have already taken action to address housing concerns by founding the agency, the housing agency, which has resulted in a good year of progress and accomplishments. So this evening, I just want to briefly share what we have accomplished since our founding, what we're working on currently, and what the future of housing activities through the Workforce Housing Agency looks like. And before we move into those housing activities, I would like to share an update on the state of housing in Truckee, Tahoe. So I'm going to give you a few seconds to review this and let this sink in. We've all, heard the stories and read the articles, but seeing the comparison from when I first started tracking this information about a year ago to now is fairly astounding. At least once a week, we're seeing a Truckee, Tahoe people post about another local family who's losing their home. Our local or regional workforce renters, nearly 40% of the Workforce Housing Agency's employees currently rent. Our renters are losing their homes at an alarming rate. And a recent housing needs survey led by the Mountain Housing Council showed that 25% of respondents have been displaced from their rentals over the last 2 years due to the owner selling or wanting to use the home in a different way. So housing efforts to keep our employees in long-term stable housing, close to where they work, if that's what they prefer, it's really never been more important. So 7 months ago, when we presented to you, we provided an overview on the recently completed Workforce Housing Needs Assessment, the survey that we conducted with your employees in July of 2020. And at that time, we did share some fairly concerning statistics. I remember all of us sitting here on the screen, shaking our heads. And I am bringing a few of those statistics up again this evening, just for a reminder as to why we're here, how your employees responded, why this work is so very important. So as you'll see here in this table, the hospital's employees responded with higher percentages than the Workforce Housing Agency as a whole on a lot of these. And for me, of particular interest and concern, I would say are the first, third, and fifth items on this table. So those considering leaving employment in part due to housing, those currently renting, and then those living outside the area. These numbers represent probably the greatest potential for turnover over the next few years. And fortunately, we are working on programs and projects and putting them in place to hopefully offset these numbers before we really see them become a reality. So while the survey presented some concerning statistics, it wasn't all dire. It also provided us with a number of possible paths that we could take on this housing journey. Your employees really told us what was important to them, and my board took these programs that you see here, along with almost 20 other options presented by both employees and the consultant, Wendy Sullivan, that we worked with, and created a 5-year housing work plan to help us guide us through the work. So the 5-year work plan, we started with focus areas. Where do we really want to place our energy and our commitment over the next few years? So in developing our focus areas, we asked, how do we secure housing that we can control and provide to our employees, no matter what the market looks like, what the levels of displacement are? We asked, how can we expand the programs we're already administering? How can we build others to respond to the employee needs that we saw in the survey? And then finally, are there any non-housing related opportunities that could potentially help ease the burden of housing costs for our employees? So these are the 3 areas that we chose to impact in the coming years. We established fairly conservative targets for the work plan. We were 6 months in when we started or approved this work plan. We knew that we're still new, we're building our foundation. So if we can get to a place where we are actively supporting over 10% of our employees within 5 years, while also working with our regional partners to move their housing programs forward, that will feel like a really big win. So I've listed here the 6 activities, main activities we've included in the housing work plan. And these all kind of fall under those 3 focus areas that I just shared previously. I'm going to talk briefly about each of these and would love to hear questions or comments on them at the end of the presentation. Development of workforce housing. We are currently completing a land mapping exercise to explore development on member agency owned land. And in addition to that, we are meeting with other public agencies and developers to explore potential partnerships on other parcels. And I'm hopeful that on the development front, we will have some good news to share with our boards, in the coming months before the end of the year. Our master leasing program is currently being built, and I'm hopeful that we can begin leasing activities in September. We are working with different developers who have units coming online in the next 1 to 2 years to secure blocks of units in advance for our employees' use when they are available. So we would act as the leaseholder and enter into agreements with your employees to lease those units for the long term. And this approach provides, security and stability for employees, but also for unit owners. So rent will always be paid, the units will be cared for. This could potentially help us to secure units for longer than 1 year. One of the biggest concerns with the displacement we're seeing is most of our workforce is on a year or less lease. So if we can secure something for longer than that, it would be a big win. The employee concierge program is really just our fancy way of saying that we are acting as an outlet for all things housing for your employees. So I'm hearing from your employees on a variety of housing related questions and issues on a weekly basis. And this is the place that employees can go when they're searching for somewhere to live, they're looking to understand the opportunities available to them, et cetera. And this, our offering or helping people understand the landscape has been very popular, as I'll show you on a coming screen. The Housing Match Program with Landing Locals is the program that we launched last July. It connects our employees with second homeowners looking to lease their homes long term. We are currently wrapping up this 12-month pilot program and looking at what a different incentive type program could look like to increase the number of units that we can unlock for our employees in the future. On housing education, in the survey, nearly 40% of our employees asked for housing education opportunities. The questions were, how can I access down payment assistance? How do I calculate a mortgage that I can actually afford? This is how much money I make. What can I access in the community, whether it's for purchase or for rent, et cetera. How can we, and then on the homeowner front, we also had a lot of existing homeowners that share that their home situations were less than satisfactory. They don't want to leave, but they're hoping that they can, potentially work on their homes or improve their living situation. So how can we help them access loan products, rebate programs, et cetera? And then finally, as a joint powers authority, we do have a unique opportunity to work together on a variety of solutions for issues each of our agencies face that directly impact our employees' ability to afford housing. So transportation, childcare, et cetera. So can our member agencies come together through this forum to explore some of these opportunities as well? So we all know it's been a fairly challenging year, but it has also been a year of progress and accomplishments for the housing agency, which is exciting. So, we're building something that no one else has, and that takes some time. It takes resources, creativity, commitment, collaboration, all of the buzzwords. Our first months were committed to founding, and while we are completing those founding activities, we're also working to execute the housing needs survey. And in July, we began our first 2 housing-related initiatives that I had mentioned, the concierge program and the housing match program with Landing Locals. And then the housing work plan was developed and completed in December of 2020. And then finally, we've made some great progress in relationship building and cultivation with local agencies, developers, et cetera. We're talking with the town, county on a weekly basis about opportunities, meeting with developers to understand what's coming down the pipeline. Are there master leasing opportunities available to us? Also knowing that eventually we will be developing housing, so wanting to build those relationships now. So this table is an exciting one. It represents all of the interactions and housing successes we've achieved in the last year or so since we really started the housing specific activities. And I will talk to each of them very briefly. The numbers that you see in the top row are that employee concierge offering. So employees that I've connected to or the housing agency has been a resource for. And while we don't know how many houses our efforts with the concierge services have resulted in, we are planning to survey these employees so we have some more specific data to work from. On the housing match front, we have actually matched 14 employees now. We matched another hospital employee last week in long-term homes through the program with Landing Locals. And then the fourth housing purchase, a few months back in partnership with the town, we learned of a deed restricted home that was coming available and advertised to our employees as soon as we heard of it. And as a result, the top 2 applicants were airport employees, and the first applicant was selected to purchase the home. So this one is big. The HR director at the airport said that she saw him that afternoon and he was in the airport shaking with excitement. I've been working with him for a year and he was trying to move to Auburn, then he had to move to Reno. He had lost his housing in Truckee, and now he is a homeowner in Truckee. So when we can help employees purchase housing, we're ensuring longevity, and that is really, really exciting. Hopkins Village, I'm hopeful that you're all aware of this project out by Schaefer's Mill and Martis Camp. It currently has a qualified buyers list of almost 30 local workforce members, and 6 are our employees. So we've worked hard to share this project, and as a result, hopefully these 6 will have an opportunity to buy a home in a region that they probably never thought that they could afford to live in. So that's really exciting. And finally, in the last 9 months, we have been able to help over 80 employees on their housing journeys. 15 of those employees, most of whom have significant others, families, dogs. They're all in long-term housing situations because of our efforts. And hopefully in the next few months, we see another 6 have the opportunity to buy a home at Hopkins. So in the calendar year of 2021, we are hopeful to help 17 employees get into homes. And I'm hoping that we will actually be at that number in the next month or so, which is exciting. So this is more, what are we working on currently? Each of these items I've touched upon already, except for this last item. But these first 3 really are kind of where our efforts are focused right now. And on this final item, as you're hopefully aware, at the end of 2020, Nevada County, Placer County, and the town of Truckee came to us with a request that we consider bringing them in as member agencies of the Workforce Housing Agency. As a result, we hired Municipal Resource Group to help us understand whether bringing our entitlement agencies would be a challenge, a benefit, pros, cons, etc. And their recommendation was a resounding yes. This can only increase your opportunities, your resources, etc. So the board did vote to bring them on, and we're hopeful that they will be joining as new member agencies on September 1st of this year. And then finally, I just wanted to make sure that you're aware of our member contributions for this next fiscal year. They are calculated based on the number of employees each agency represents. And if you compare employee counts with the number of employees we've served so far, the percentages are almost even, which is nice to see. So we have asked our member agencies to continue to support our work through the member contributions shown here. And again, while the hospital's contribution is higher, you also represent over half of the employees that we are providing services to on a daily, weekly basis. It's been a pretty major evolution of the agency over the last year. None of us knew where this was going, COVID and the pandemic in March of 2020. And as a result, it has also shifted where we're going as an agency. But I am really proud of where we are. I'm excited about where we're going. I'm hopeful that we'll have some really exciting news to share with you the next time I see you, and hopefully that will be in person. So again, thank you for recognizing this issue and participating as a founding member of the Workforce Housing Agency. And I'm interested to hear any questions or comments that you have.
Thank you so much, Emily, for that presentation. It is a challenge regarding housing. And also I noticed that there was some information about homeowners insurance of fire hazards. So I'd like to open it up to the board for any questions you might have about Emily's presentation or about the JPA, about housing. Mary?
Yeah, thank you, Emily, for the presentation. And congratulations on the wins that that you've had thus far. I had shared with Harry at the time that there was the conversation around expanding the membership to Nevada and Placer counties, because history has shown that often when the counties have been involved, the influence has migrated to the western side of those counties. I'm wondering what has kind of been put in place to make sure that the resources and the energy gets put into the eastern side of Nevada and Placer counties around housing.
Thank you for asking that question, Mary. We actually just updated our bylaws and founding agreements to make it very clear that we only operate within the boundaries of the Tahoe Truckee Unified School District. So our services are only applicable to those employees that are living in or serving in a full-time capacity the eastern side of the counties. We want to make sure that we are serving those within the Tahoe Truckee region, when providing services to the Workforce Housing Agency.
Great, thank you.
Is membership limited to what seems to be district organizations? I mean, there's obviously other large employers in the area that are challenged by the same thing. Is there other limitations on membership?
So our legal structure allows us to welcome any public agencies that are a good fit, who have shared goals as it relates to their employees. So we can continue to expand to include special districts and agencies throughout the region. And that is something the board may consider as the years go on. We did not expect to expand to welcome the counties and the towns so quickly, but with the housing landscape shifting so quickly and then coming to us in 2020, it felt like the right decision on behalf of the board. So we can expand to include public agencies. And then on the local business front, there's a lot going on, especially as it relates to kind of emergency ordinances and temporary housing that we are, making sure that we are in conversation with, though our services and mission are specific to the employees of our member agencies.
Quick question, are there many other public agencies that could potentially become members?
Yeah, so outside of the government agencies or the entitlement agencies that we're bringing on soon, we also have 18 special districts within the region, 4 of which are currently member agencies. So we could expand to include the other, the PUDs, sanitary districts, et cetera, in our mission. And all of our special districts look very similar to ours in regards to their employee makeup, their employee needs. Income is somewhat within the same pool. So in the future, there is opportunity to expand if the board feels it's a good fit.
Well, as you get more successful, they may want to join because they see what's happening.
We're already hearing from them, but we want to make sure we're not growing too quickly and that we can actually serve the mission that we are pursuing before we continue to bring in new member agencies and increase the number of employees we're serving.
Yeah. Okay. Thank you.
Mm-hmm.
Emily, do you find that individuals' desires in a home are different than maybe my generation? I mean, when we were buying our house, we had really very specific things. We wanted a yard, we wanted a certain amount of square feet. Are people just looking to find any place to live, or are they being a little bit more selective? Are you finding that at all?
I would say in the last 6 months, people are no longer picky. We had a hospital employee actually write in and share, she's been living in the area for 20 years. She's moved 13 times, and every time the goodness of this community has stepped up and supported her. And this is the first time that she's worried that if she loses her housing, she won't have the community to support her. So things have shifted pretty drastically in the last 6 to 8 months, especially the last year since the pandemic hit. But we are seeing more of a I need housing, period. Though with Landing Locals and our program, with them, the housing match program, Landing does share that many of our employees are really trying to get into long-term housing to start families, to support their families. They still have those restrictions and guidelines they want to stick within, but right now, people are pretty much asking for any type of housing they can get.
Emily Dale here. Mike Schwartz, the fire chief at North Tahoe Fire, spoke to our Rotary Club a couple of years ago, and he mentioned that the last fireman who lived in the lake basin just retired. So all firemen now come from out of the area. In an emergency situation, that often puts them an hour to 2 hours away. And it would seem to me that for public safety, that it's in their best interest to get housing here locally. Why are they not joining this JPA?
I think there's probably potential for that expansion. Like I had mentioned, I know that the board doesn't want to grow too quickly. You know, we have some wins under our belt, but we don't have big blocks of units secured or housing developed. So I think the board wants to make sure that we are safely moving down that path before we continue to consider expansion. So I've heard from a number of our local agencies around interest in joining. And the other thing that we have that could be of benefit, even if they didn't join, is as we secure blocks of units through master leasing or develop housing, there may be a component where the board chooses that 15 or 20% of these units go to other agencies in the region, other public agencies in the region. So there's opportunity, even if we don't bring them in as members, to partner and support their employees' needs as well.
I think, Emily, I saw something on one of your slides about homeowners insurance, which is a big issue for anybody who owns a house getting reinsured. Are you helping in that area?
So that was one area that the board was really interested in seeing. You know, we're bringing together 4 very strong agencies. Is there a way that we can collaborate to access markets that maybe Truckee Tahoe doesn't currently have access to? What we found through our research, and Director Kevin Smith over at the airport has helped me with this, is that our role may be more of an advocacy role. So making sure that things like, I believe it's Measure T that's currently or potentially on the ballot for housing remediation funds or fire remediation funds, that we become a strong advocate for that, because it's only going to help our employees in making sure that their homes are secure and they can potentially access homeowners insurance. So while we haven't found a path to actually, lowering costs or accessing different markets, we are finding a path and making sure that we're supporting what's happening in the region.
Good. Thanks.
So Emily, can you talk to us a little bit more about the mileage commute reimbursement? Because that seems to be a high percentage of interest.
Yeah, that is kind of on the list of potentials, though it is not something that has risen to the top yet. There was conversation by the board around, again, we represent nearly 2,000 employees, and 20% or so are living in Reno and outlying areas. Are there other things that we can be doing, like North Star bringing their shuttle service to Reno and back up to Tahoe, Truckee? So we haven't, as a board, discussed the actual incentive or offset to help with that. It's on the table, and we are exploring other options around that.
I know that in the Bay Area, that has been a big benefit to many of the employees who can't live near their place of employment, that they get commuter dollars, and people like Google will come and pick you up at your house. Not that we're expecting that, but I know that without public transportation or extensive public transportation, it's difficult to give them a commuter pass or something.
Yeah.
But I can see where indeed Reno is growing just as fast as we are. And I know there are complexes going up there with 2,000 kind of apartments, condos, or whatever, where people might say, this is where I want to live, but I can't afford to keep commuting. And
yeah,
that might be an interest of them too.
Yeah, and while we know that the heavier lifts right now are the housing development and the master leasing and getting those programs and projects off the ground are big wins, there are these other activities that we need to be aware of and we need to be working towards. So they are on the list of potential ways to support employees, ensure retention, et cetera. And I'll make sure that, that item is something we continue to explore.
Thank you. Any comments from our audience?
This is Harry. I would like to really thank Emily for her hard efforts over the last year plus. She's got a good grasp on issues. We've got a good board and I think really good support. We're at the early stages of this, but as you can see, it's a very, very important matter. It's a very complex matter. And it's certainly something I think about if I wake up at night, and I certainly think about it a lot during the day. You know, housing is critical for our team, and it's going to take several solutions. It's not going to be solved with one or two items, but hopefully we can make a difference. And she's really collaborated well with a lot of private and public organizations and has a good pulse for what's going on. So our board really appreciates her hard efforts to date, and we've got a lot of hard work ahead. So thank you.
All right, thank you again.
Thank you all very much.
Thank you.
Thank you.
We'll move on to item 16, items for board action. 16.1 is a resolution to support Tahoe Forest Hospital Trauma Center. I know last month we passed a resolution to support the medical staff who supported the trauma center, but Karen Buffone is here and she's going to speak to the resolution and have us vote on it. She was here.
Good evening, board. Can you hear me?
Yes.
Can you hear me okay?
Yes.
Okay, great. Time for the trauma center as we get ready to go through our survey for our level 3 trauma designation. So I'm looking for a resolution to support the Tahoe Forest Hospital Trauma Center. And I'll go through that with you. Whereas Tahoe Forest Hospital District is a hospital district duly organized and existing under the local healthcare district law of the state of California. And whereas the board of directors at Tahoe Forest Hospital support the Tahoe Forest Hospital Trauma Center. And whereas Tahoe Forest Hospital desires to operate as a verified trauma center by the American College of Surgeons. And whereas the board of directors of Tahoe Forest Hospital is recommitted to supporting verification of the trauma center by the American College of Surgeons by supporting exceptional professional and paraprofessional personnel in trauma care and hospital administration who are promptly available to support acutely injured patients. Utilization of sophisticated resources, equipment, and ancillary services dedicated to providing the highest quality of trauma care. The role of the trauma medical director to ensure that trauma patient needs are a priority. Capable resources to support the trauma performance improvement and patient safety plan, maintenance of leadership role locally, regionally, statewide, and nationally in the delivery of care to trauma patients and coordination of trauma care systems within the community. Provision of education in trauma care for attending physicians, nurses, pre-hospital, and other paramedical personnel. Provision of trauma injury prevention programs to the community it serves, and capable of resources to support a trauma mass casualty response plan. So I am looking for it to be resolved that the board of directors of Tahoe Forest Hospital District hereby affirm that the trauma center is an institutional effort, the success of which is dependent upon a firm commitment of the medical staff and hospital leadership. So I am looking for that resolution to go to vote.
Not like we've not been discussing this for how many meetings.
A
But
very
all we're
long
doing-
time.
We're here with the resolution. We're just affirming that we indeed support this.
That
But
is
are there
correct.
any questions from our board about the resolution?
Have
Dale.
we done this resolution before, or this type of resolution for the trauma center? I
We
don't
did one
recall.
last month.
I know, but there wasn't.
For
wasn't for
medical
this, yeah.
executive,
No.
but not for the hospital, in support of medical executive committee. We need to do one as a hospital.
Okay. Karen, Dale here. I probably should have asked this question to Dr. Lane, but it came to me this evening in our certifications. Do these trauma doctors, when we increase the level from 4 to 3, do these doctors have to have special certifications in order to qualify themselves as being capable to support a level 3 trauma center?
Karen, you're muted.
Karen, you're muted.
I'm sorry. Yes, they all go through a certification process.
They did. Okay.
Okay. Well, how about our audience? Does our audience have any questions for Karen about the resolution that the hospital district is going to support? Okay, hearing none, can I have a motion to support Tahoe Forest Hospital Trauma Center, a resolution 2021-02?
So moved.
Can I have a second, please?
I'll second. Mr. Dart?
Okay, so it's been moved by Director Brown, seconded by Director King, that we pass a resolution 2021-02 to support Tahoe Forest Hospital Trauma Center.
Director McGeary?
Aye.
Director Shamblin?
Aye.
Director King?
Aye.
Director Brown?
Aye.
And Director Wong?
Aye. So Karen, the resolution has been passed. We'll have it signed for you. And is September the date, the month? That
Yes, it is.
The surgeon, the College of Surgeons are coming. Okay. We'll look forward to hearing the results of all of that. So thank you again for doing the resolution today.
Sure thing. Thank you.
16.2 under board action, approval of the fiscal year 2022 President and CEO incentive criteria. And we have our CEO incentive criteria committee to present the criteria. So is Mary and Art?
Yes, we're both here, and Art, I hope you'll jump in as well when we make this presentation. Art and I met yesterday afternoon as the Executive Incentive Compensation Committee. We were joined by Harry and Judy and Crystal, Alex, and the omnipresent Martina. And we had 2 items of business at the time. The Executive Comp Committee is charged with the annual review of the President and CEO's job description. And I think you saw in your board packet a red line version of that job description. Really, the only change was in changing the name of the entity from Tahoe Forest Hospital to Tahoe Forest Hospital District. I put that out there for you. The committee did vote to recommend your approval, but because it was not on the master agenda for this particular meeting, we're going to defer that board approval on the CEO job description until next month. So are there any questions with regard to that item? Okay. Well, then we had a very long and very thoughtful discussion about the compensation criteria. And we folded into that a lot of the suggestions and ideas that you all talked about the last time we made this presentation. Martina sent out a copy of the proposed measures or metrics that are going to go into the compensation. She sent those out to everybody right after the meeting, but I think she's going to post them for our ability to see them now.
Oh, there we go.
Okay, thank you, Martina. So as always, the first item on the schedule is finance. And our goal is to meet or exceed the budgeted net income as approved by the board for the fiscal year. earlier today, we approved that that budgeted net income line would be in the realm of $18 million. This has always been the first item on the schedule because it has in the past been sort of a, I don't know if you will, I call it a make it or break it thing. If you didn't make the finance number, all of the other incentive measures were pretty much moot. But this year, as you'll note where the double asterisks are, we put in a line there that says that the board has the discretion to pay out service quality growth and people incentives, even if this finance goal is not fully met. And we figured, you know, we can do it. We don't have to do it, but it is at our discretion, and it gives us greater flexibility in the future around the incentive plan.
And I think just to butt in for a minute, these
Sure.
other four categories we determined are also very important. So just for whatever reason, we may not meet the finance one. It doesn't mean these other ones aren't important and they shouldn't be rewarded if they are met.
Right. Thank you, Art. Okay, if there aren't any questions about finance, we'll move on down to service.
I'm sorry, Mary, are we going to put in the criteria, the actual 18 million where it says?
Yes,
Okay.
I would suggest that we do that.
Okay,
Okay, the next item here is service. And when you see service, think patient satisfaction, because that's the score that we are working with. There was a lot of discussion around this because we're operating in a very unusual climate right now. And Harry, if you want to jump in and speak to this a little bit, we're finding, as you may have seen from Harry's emails of the past week or so, a different environment in that people are more frustrated, maybe a little more hostile, a little more angry. And it's been reflected in attitudes around the district. So the number that you're seeing here, the average of 93.76 on the Prescaney score, is actually a continuation of the score that we had last year. We decided not to raise that score this year because of the climate. But we did make a note that we are looking forward to raising that score next year, or that goal score next year, if the environment changes. So we are recommending the 93.76 under patient satisfaction. Are there any questions with regard to that?
Mary, it's not so much a question of that particular one, but I did notice that our percentages for each of the criteria have changed.
Right.
Are you going to talk to that?
Yeah, I was going to mention that at the end.
Okay, thank you.
But that was a good catch, Alice.
She read it.
Right, there you go. So the next item is quality. Our goal is to meet or exceed 97.20% of the roll-up of the quality measures. This is interesting because the quality measures change from year to year. There are certain parts of the bundle that we have been able to get our hands around to our satisfaction, that we no longer feel need to be measured as part of this bundle. So we have moved something else in that has been a challenge for us. So for example, we had flu vaccines in there last year. Well, that's pretty well taken care of. So we moved in readmissions, which has been a challenge for us. All the items that you see here in some way are reflected on the hospital compare measurements that we sort of had a little bit of a struggle with last year. So this is a combination of some old and some new items bundled up to make that quality measurement. Okay. So the next item is growth. And we were fortunate in that Crystal was able to go back over the last, I don't know, 4, 5, 6 years and to track how the office visit totals have moved over that period of time. And in the past, we've set a goal for ourselves to increase our physician-owned and managed office visits by 3,000 per year. And this year, it didn't seem to be too much of a stretch to increase it. I guess I shouldn't say that, right? It seemed to be appropriate to increase it to $5,000 for these practices, 5,000 visits, I'm sorry, for those practices.
Mary, a question.
Yeah.
Sure. How do telemedicine contacts measure in here?
It's my understanding that they count as an office visit, but does anybody want to correct that?
They are counted. It's face-to-face and telemedicine visits each year. So they're in all of our baselines and they've always been in the measurement here.
So a telemedicine visit that's billable, I assume.
Correct.
So Mary, also on the number of visits, we're increasing it to 5,000. Have we seen a trend, and are you doing a percentage based on the trend, and that's how many we expect? Where did the 5,000 come from?
It wasn't a strict percentage, but yes, it looked that way as it was trending out.
Okay.
Obviously, I mean, if we had 110,000 visits this year, 3,000 on top of that is a much smaller percentage than what it had been when it was 40,000. So,
okay.
So that's how that moved forward. The last one here is people. And I think everybody would have been really heartened to have been there and to have heard time and again that everybody in the room stated that, you know, people are our pride, they are our greatest asset, and they really wanted to pay attention to this particular category as best as possible. Every other year, we do a staff survey or a physician survey. This particular year is a year for the physician press engagement survey. So what the team did is they went back to the last engagement survey and found those areas where we fell below the national benchmark. And you see those questions right here in front of you. And off to the right, you'll see how far we were off of the national benchmark, not by much, but certainly those are areas that we can improve. And I commend the group for picking those areas where we were challenged and had some improvement that we could make.
Well, Mary,
So
I think these were not only below the national average, but these were the 6 lowest scores.
Yes. And they also were the 6 scores that had to do with leadership. And obviously that's what we are trying to reward in our executive compensation, is the leadership around those issues. So that's why these particular items were picked. And so rather than using the verbiage meet or exceed, as we've done in other items, we decided to drop the meet, and we expect that the score of, what is it, 3.59, which is what we achieved before on these questions, will be exceeded. We didn't set a goal necessarily by how much, but we do have an expectation that they will be exceeded. So Art, did you have anything more to add to those measurements?
No, as you mentioned earlier, it was a good discussion. You know, there was feedback last year from the board that, you know, maybe the percentages on these 5 criteria needed to change a little bit. So we looked at how best to do that. And, you know, the people criteria went up 3%. That's the largest increase. And quality and service each went up 2%. And we took the difference away from finance, which was originally at 60%. Just because we thought, that's a goal that we seem to meet fairly easily each year, due to a lot of hard work. But we really wanted to focus on these other 3 areas. And growth, we've also reached fairly easily in the last number of years, where we had the goal set at 3,000 new visits. So we did increase that to 5,000. So it's a change, and we'll see how it works. But it was, I think it's a good change.
So yeah,
I agree with you. I really appreciate the committee really looking at that. Finance has always been like number one. If you don't have the money, you don't have the mission. But my concern, like yours, is that we put such an emphasis when we discuss people that I agree we should put a higher percentage on that. I think it's going to be difficult this year after listening to Dr. Lane speak about the joy of medicine to see what happens with that survey. The one thing that I did notice is that question 34. Question 34, I have confidence in hospital administration's leadership. In both of the surveys that the physicians have done in the past, I don't know if it's the same score, but that always seems to come up as being a low scored item. So I'm not sure that, how you change that perception. From what I see at meetings with the physicians, that administration and our president and CEO, really have been very open with what's been going on, talking to them about issues that they're concerned about. So I don't know what to do about that, but it is something that I want to see high. I'd like to see that one increased in terms of, and when we get our scores from the physician survey, that one especially is higher.
So that would be your area of focused interest.
Yes.
Right. Okay. Thank you. Well, it was for that reason, because of that whole climate of dissatisfaction and the like, that we decided not to raise the goal to a specific number, but simply say that we would want it to exceed the previous score.
And truly, that one could still drop and we could still meet the criteria because other parts of leadership have increased. So again, it's a fine balancing act, but I certainly would like to see them have more confidence in our administration.
Great, thank you. Well, this is coming to the full board for ratification. Please know that it's coming with the recommendation of the Executive Compensation Committee, and toward that end, I would move its approval.
Okay, can I have a second to Mary's motion to approve? Oh, I'm sorry, we have to discuss it first. Are there any comments? Any other comments from our board? Any comments from our audience? Okay, well, hearing none, then Mary has a motion that she has initiated to accept the recommendation for the 2022 President and CEO incentive compensation criteria. So we need a second.
Michael. Yeah.
Okay, Michael seconded. And Martina, can you do the roll call vote?
Director McGeary?
Aye.
Director Samblin?
Aye.
Director King?
Aye.
Director Brown?
Aye.
Director Wong?
Aye. So the motion of the incentive comp criteria is approved. And Harry, I know you're up to it, up to the challenge.
Thank you. It was a very healthy discussion for the benefit of our health system, and I appreciate the committee and the board's thoughts and actions on this.
Okay, I've lost my page.
This is where we say goodnight.
Okay, that's right. So we won't have any board committee reports since we've taken action on finance and action on the incentive comp. Any other committee reports?
We did, the foundation met this week. Just a quick update, year-end numbers was 864,000 on the year with very impressive number, actually, with no events being held, obviously because of COVID. So great support from the community there. We had some presentations from new imaging system being put in place and kind of an understanding of the expenses associated with that. I think everyone was shocked at the total cost, not because it was high, but just all you think of just the one cost of the unit, but then the construction and all that and the time, and it was a massive effort to get that system put in place for us, but clearly a differentiator for us and a strong asset for the community. So that was the major updates. I think the thing everyone was most excited about, they announced our next meeting will be in person for the foundation. So we are returning to normal. Yeah.
I'm glad you're going to be normal, Michael.
I didn't say I would be, but the meeting will be. Yeah.
Okay. Any member of the board want to give a report or any closing remark? I do have go ahead.
Is it next month that we're hearing the Joy in Medicine presentation, Art?
It was in the next month or two. I don't have the schedule in front of me, but it's definitely scheduled for the next month or two.
Right. Okay. And then just a closing remark from me is that I received a letter from Placer County, the grand jury, and it was about our website. And what's going to happen is, I think you heard it from Marina, that there was an addition to the Brown Act in 2017 and 2019 in regards to the website and the agenda being posted. And we have it all there, but there's some confusion, I think, about our title, who we are, and we can prove that we have all those things in place. And a rebuttal response will be sent to the grand jury, giving them that information and showing them that we indeed are compliant. Ted and Martina are going to take care of that. And Ted, do you want to add anything about it?
Yes, I think that there were essentially two items that they took issue with. One was they didn't believe that we owned a website because we are using the title Tahoe Forest Health System. So we will put a banner on there that states or identifies us as a political subdivision of the state of California and a district. And we will add some language in our history area also about the people of our region establishing a district hospital. So we think that's what caused the confusion there. The other item has to do with how they get to your agendas and the code. And I'm glad David is here. He would state it better than I. The code has essentially two options. One is a direct click on the landing page to the current agenda. Or if you have an integrated managed, I can't remember the full name of it, David, but it's a page where we list not only the current agenda, but past agendas and minutes. We can go to that page as long as the current agenda is at the top of the list and can be clicked. So we're going to argue we are compliant with that part of the code and certainly the intent and spirit of the law. So those are essentially the two issues as far as grand jury reports go. I'll take this one anytime.
Yeah. And I wanted to say
Integrated, it's called an integrated agenda management platform.
Thank you.
Oh, there you go.
And just to let you know, we're in good company with non-compliance. I think there were only 14.
That's also known, David, as a website.
I didn't write the legislation.
Yeah.
That's the technical term.
Yeah.
But again, I just wanted to say that when the report came out, there were so many districts and independent organizations that they cover that did not have compliance. And so I felt like, the grand jury might have to look and do a little bit more investigation before they put out all the lists. But in any event, we'll take care of ours, and it's there, and people can find the website. They can find the information they're looking for, and we're just going to show them how to do it. Okay, any other comments? If not, it's been a long day, and I want to thank all of you for putting the time and the effort and the engagement in. And I am going to adjourn the meeting.
All right. Good night, everybody.
All right. Good night, everyone.
Well,